Hello guys, you're welcome to my channel, and today we are going to talk about traditional medicine. Traditional medicine is something that we see all around us as healthcare professionals. We have a lot of patients coming in with complications from traditional medicine. We have a lot of patients taking drugs along with traditional medicine despite all that we say to them. So we want to talk about the good, the bad and ugly about traditional medicine and see the way that we can improve on the care that we give to our patients as regard the traditional their use of traditional medicine. And so today we'll talk about the truth about traditional medicine dispassionately using evidence from credible sources like WHO, Ghana Food and Drugs Board, and then Ghana Health Service. So when we say traditional medicine, we are talking about every healthcare practices that is not part of the main healthcare system. So um, we used to have a healthcare system before the white man came in, and when the white man came in, he established what we have right now as the main healthcare system. So anything that is not part of this system is what we call traditional medicine. And so examples of this are herbal medicine, spiritual healing, homeopathy, massage, meditation, all that you can think of that are not a part of the mainstream healthcare system. And it is of importance because at least 70% of the world's population rely heavily on this form of medicine for their primary health care. So it means that when they are sick or when they need health care, that is the first thing that comes to mind. That is what they assess first before later they go ahead and then assess the mainstream health care. So contrary to popular opinion that the allopathic healthcare system or the main healthcare system doesn't really care about traditional medicine and doesn't really respect it, the WHO has recommended that all its member states or nations find a way to integrate traditional medicine into their main healthcare system. And there's even a unit created by WHO to oversee this. And Ghana, as a member state, has also put in effort to try and integrate traditional medicine into regular healthcare systems, such that we have pilot hospitals trying to do this. And one of these hospitals is the Lekma Hospital in the Greater Accra region. So some famous plants in traditional medicine that we use across the world is what I want to mention here. We have the opium poppy. It is used for pain medication. The salvia plant is used to calm yourself. Coca plant, where we get cocaine and pain products. We have tobacco plants. People take it to calm themselves down. Neem plant for malaria. Cannabis, people smoke it for recreation. People also smoke it for medicinal purpose. We have turmeric for inflammation, chamomile for anxiety and sleep, tea tree to treat um, common minor skin disorders. Evening primrose has vitamin E to help balance the hormones, ginger, anti-inflammatory, lavender for anxiety. So these are some popular traditional medicine that we. But it is worth mentioning that modern medicine as we know now wouldn't have existed without traditional medicine. And so most of the drugs that we use today are derived from plants. An example of such drugs are lidocaine, and a local anesthesia, use it for suturing minor wounds, for pain management. We have atropine, a drug that is used to dilate pupils to be able to help the optometrist observe or look at your eye very well. We have morphine, one of the best pain medications. We have metformin, one of the best type 2 diabetes medication. We have quinine and artemisinin for malaria, and then aspirin for pain. So these plants obviously have something in them that makes them potent, and that is what we call bioactive compounds. And these compounds are able to interfere with the way your body works to make sure that it gives you pain relief or treat a certain problem. So with this being said, can we say that herbal medication can be harmful? They are potent, and anything that is potent or anything that has power is supposed to be taken with care, otherwise when you abuse it, you might easily cross the line from white to red. So why is it that currently traditional medicine is not getting the respect that it has, even though medicine as we know right now wouldn't have existed without the traditional medicine? It is because of inadequate regulation and registration of the products that they peddle, a poor mechanism of monitoring the safety of the drugs that they claim to sell, the lack of training and education of traditional medicine practitioners, and then the lack of research on traditional medicine. Also, there is a huge influx of non-indigenous traditional medicine from outside Africa. So we have a lot of drugs coming from China, coming from India, and all these drugs, some of them do not even have their writings in English for you to be able to tell what they contain. So they come and then people take it and they try to even hide it from the Food and Drug Board that is meant to certify whether these drugs are safe or not. So can we say that traditional medicine can be harmful? Yes, it can be harmful if we are talking about a straightforward answer. Like any other medication, every medication is a poison or can be a poison depending on how it is used. So when we look at the three main factors that the American Society of Nephrology highlighted as something that we need to consider before we take traditional medicine, and it's something that we also need to consider before we take any medicine. So first of all, what herb are you taking? What does it contain? What is the active ingredient? How was it stored? How was it processed? How was it transported? Some of these herbs are even contaminated with heavy metals like mercury and lead. So if you have a drug that is contaminated with this, definitely when you take it, it will be harmful. Treatment factors. Every drug should have a duration. How long are you taking it? What dosage? Most of these treatments do not have dosage. They say take it till when you are tired. So people take it no end in sight. They don't know the dosage. They can take 1 cup, they can take half cup, they can. And then patient factors. Some patients themselves are not very well. Their kidneys and liver are already failing. And so when they combine all these drugs and take it, it has a toll on them. So these are the three factors that the nephrologists want us to consider. And the anesthesiologists are also saying that for surgeries, they want you to stop taking these herbal medications like 2 weeks before any surgery, because they've realized that those who take herbal medication can have problem with their clotting. So you don't want your body to refuse to clot whilst you're in surgery. And your electrolyte balance is very important. All these minute elements like sodium, your potassium, your chlorine, everything has to be in the right proportion. But if you are taking a traditional medicine that is messing that up, then it's a problem for the anesthetist whilst you need to do a surgery. And then sometimes it interferes with your anesthesia. It might prevent the anesthesia from working well, or it might prevent you from coming out of anesthesia as soon as you need to come out. So these are the two top societies talking about their experiences with traditional medicine, and I think it is something that we need to pay attention. Despite all this, why do people still use traditional medicine? Yes, they will use it because first of all, they believe that it is potent, it works, and they believe that it is effective, it is available, it is cheap, and sometimes people have no option. They've been to the hospitals. The hospitals say, we are done, there is nothing we can do for you, go and seek something else. And so they fall onto traditional medicine because that's the only alternative they have. And some people are afraid of surgery. Traditional medicine is offering an easy way out. So for instance, somebody comes with fibroid, we are told, madam, you need to do a myomectomy, and she says, hey, okay, I'm afraid. Then she hears somebody saying, oh, I can give you a concoction to take, then the fibroids will fall off and you pass it out as feces. You definitely want to give it a shot because surgery is scary. And then culture. Some people's culture is to take herbal medication, and so that is what they are used to. so they will continue to take it. So the role of nurses and midwives in ensuring safe integrative medicine. How can we as nurses and midwives ensure that even though 70% of our patients are still taking these medication, but they are still coming to seek allopathic healthcare, how can we help and make it safer for them in our life? So first of all, we need to educate ourselves about the traditional medicines in our community. So for instance, midwives will know that certain women will take a certain drug to hasten the labor, and most of us don't even know the name up till now. We've practiced for like 10 years, but nobody's interested. So we need to know what kind of medication they are taking. And then we need to get our information from credible source online if possible, or even talk to these traditional herbal medicine practitioners themselves. When they see that you are non-judgmental, they'll open up and then tell you what they are giving to their patients. And then you have to respect the culture of the patients, because it's only when you respect them that they'll be willing to open up and share more with you. If you come out as judgmental, then they'll keep everything to themselves, because they know that the moment they say it, Mamines will shout. But mind you, they are still using it no matter what you do. So we need to talk to them with respect their culture, and then when they open up, we negotiate with them and try and see how we can help them reduce or limit or combine these drugs safely. So for instance, somebody is on antibiotics, the person is also taking something that will help cleanse the system. Mind you, this thing is going to flush the drug out quicker than it should and not make it effective. So if the person opens up to you and tells you, oh, I'm taking something to clear my system, and you're like, okay, we've given you antibiotics, so if you take this right now, it might not make the antibiotic work. So why don't you wait a little? When you finish the antibiotic, then you can continue. Just little things that we can do to make it safer. Then, in conclusion, we'll say that right now there is not enough evidence for anybody to categorically say that traditional medicine is bad, even though there are challenges. But there is not enough data to say that the drugs themselves are bad. So we are with it. We need to accept that, and that we need to know that across all continents, Europe, Asia, Africa, America, these traditional medicines have been with us from ages, and so it can't just fade away. And if about 70% or at least 70% of our patients are relying on traditional medicine, then it means that it's something that we need to take serious. So as advocates for our patients, we need to be interested, and WHO is also backing us to help see how we can integrate these things together. We can also do research, little research here and there in your community. What drugs are they using? You can do research, and then you can also do research and then see what these people are using. Engage with the local traditional practitioners, talk to them and see what they are doing and the rationale for what they're using these drugs for, so that we can also be in knowledge. So look at this cartoon, it's quite interesting. This man is at the all natural supplement herb vitamins and center, but look at him, he's gone off, he's intoxicated totally, said that police has to come in. So the fact that you are using alternative drugs to doesn't mean that it will always be good. Alternative drug deal can also go bad. So let's be careful and respect these traditional drugs, because thank you very much for your time. Have a nice day. If there are anything you want us to address, please hit me at the comment section.